So at this point, I'm going to hand it over to Michelle, and I'm going to share my screen for the graphic that she is going to use.
Thank you. And I'm not going to take it personal that you also forgot me. So
no, I didn't forget
my
you.
value. Oh, you didn't? You were just.
I was segueing
in. Okay, right. I'll let it slide this time.
I'll add mine at some point too.
Yes.
So my name is Michelle Salvador. I am the Regional Substance Prevention Consultant through the Morrisville District Vermont Department of Health Office. And I wanted to pass on non-judgment, and specifically in lots of ways, non-judgment of many things, but specific to this work, non-judgment of people that use substances or struggle with substances, because that's one of the factors that often prevents people from being able to come forward and outreach for support. Okay, so Jessica is sharing her screen, and she's gonna pull up, there we go. Does it get bigger than that?
Yes.
Okay, great. And just bear with me just 1 second. Okay, so I just wanted to share a little bit about the history of, what came before this document and how did we get to this document. So one aspect of my job is I work providing technical assistance to the Healthy Lamoille Valley Coalition on research-based prevention strategies. The model that we use here in Vermont is this that you see up on the screen, is the prevention model. And the work that we do occurs on all these levels: individual work, relationships. It occurs within and with organizations, at the community, and then also up in this kind of policy systems level that you see on the top. And what we do in prevention is we work specifically with the data. All of our prevention work is based on data and is based on research, prevention research. So we know that the strategies that we're doing do work. So what we do is we take a look in our communities at what are the risk factors, the things that exist in our community that put young people at a higher risk of using early in life. And then we also look at how many protective factors do they have in their life, and how do we work to build those protective factors in our communities. Because we know that young people who use substances before the age of 15, while their brains are still developing, are 6 times more likely to develop dependency in their life than those who wait until, say, like after 21, when the brain is becoming more fully developed. So, and we've done a lot of assessments of our data. It's an ongoing thing. We're constantly collecting data and looking at it and adjusting what the focus of our work is. And in our community, some of the biggest risks to our young people are a couple risk factors that rise to the top. One is that community laws and norms support use in our community. And also there is a lot of access and availability to substances in our community. So one way that we address those risk factors is by implementing strategies at that policies and systems level. They sometimes call it the environmental level. So like when we work at the individual level, we can make a lot of change with just a few people. But when we work at this level, we can make smaller changes, but across the bigger population. So we can really change the environment that young people are growing up in. So we know through our research the positive impact that changing community norms has on preventing early life use of substances. So several years ago, I don't even know how long ago it was at this point, we wanted to do a lot more work at this environmental level. That's where the field of prevention was going, to get that really bigger kind of more community-wide impact. So we thought, well, one area where we could do a lot of work, especially around laws and norms and community, is by working with town planners and select boards, and really develop them as prevention partners. So we developed this document called the Prevention Primer. And the primer was really well received, and it was duplicated all over the state. But over time we realized that it could be really improved if it was more like a workbook, and that we took it out of kind of that select board planner sort of language that it had been in. And we thought, what we wanted to do was really, how do we take people through a process of taking a look at their communities, and like the activity you did in the beginning of the Zoom tonight, identifying what are your values in your community, and what is the vision for health and for young people in your community. So with that, I just want to say congratulations to ALISON and the whole crew at Healthy Lamoille Valley, and all the hard work that went into developing this really incredible workbook. And I would say it definitely is a first in environmental community prevention. So I'm really excited to see where we are able to go with it in our community. So that's about all I have to say without taking up too much time. And I want to turn it over to ALISON now, who's going to just kind of dig into this workbook and what's in it.
Great. Hi, everyone. Thanks, Michelle. And thank you, Michelle, to all of the collaboration on this, this 2.0 version. It was so valuable to have all of your insights and input along the way, really leading this effort. And I just want to thank everyone for being here. I know time is precious, and that you're spending the time with us tonight to take a look at this new toolkit and actually use it. We're going to use it and see what next steps for this toolkit might be. Before I share the toolkit with you and kind of go over an overview, I need to acknowledge Elisa Clancy, who is here on the call right now, who is not just our web designer and the designer of this document, but is also a community member, parent, part of the coalition. And Elisa needs to be acknowledged because when I first came to Elisa with this project, she told me how things usually go. People have all the text prepared and ready. They hand it off to her. She does the design work. You're smiling, I see, Elisa. Send it back and have a few edits. This was very different. This was different. There was a vision. After I had worked with many planning commissions and select boards since I started, and realized the document that I shared, the original document, is wonderful, but I was saying, go to play, I was doing an activity and then saying, let's shift to page 11 for some language. Like, it just wasn't working the way that I wanted people to engage with it. And so, coming with this vision to Elisa and saying, okay, I have all these ideas of how to do it, but like, how are we going to do this visually? And Elisa was not just the designer. Elisa, you were a co-collaborator, co-creator in this in a big way. You went above and beyond just design. You were reading it as a community member, a coalition member who deeply cares about this work. And we are all so grateful, I especially, because this would not have happened without all of the effort and care that you put into it, specifically your insights. So thank you, Elisa. We can all look to Elisa, who's right there. Wave. Yes. Thank you so, so, so much, Elisa. So
you did a great job.
Yes, I bet you're glad I'm not texting and calling and
No. You did a great job with it, really. Okay,
Yes.
Thank you.
Okay, it was wonderful to work together. Thank you so much. And I think I'm curious, how many people are able to pick one up or have a hard copy? Few people have some hard copies. If you don't have a hard, I think I might have bumped into Greg and given him one, or if you don't have a hard copy, they are available. But I just wanted to show you, first of all, where you can access a copy, even to print it now, or just to have a copy for yourself. So I'm going to share my screen to get us into it. All right, here we go. Everybody with me here? So you see the Healthy Lamoille Valley website. And right here is the Community Planning Toolkit. And we click. And so this toolkit was meant to be a living document, which is why it's living online. We did print copies and they are beautiful and nice to have, to really like lay out and write in and work on. But it's meant to be accessible. We want, real goal is that people use it and use it, maybe not all at once. Like tonight, we'll be using different parts of it in small groups. We want people to really engage in different ways and be able to access it through also, through different access points. We really want to make sure that building on what Michelle said, just building that awareness of the messaging in our community that is messaging towards the risk factors and towards substance use, but also what we can do and the protective factors and protective strategies, what we can do in our communities. So, it really is meant to have multiple points of access and to be used in different ways. And it is a living document. So here we are. This is the online version if you haven't seen it yet. And I'll just scroll down a little bit so you can see. So here we are, right, at the top is view the community planning toolkit. There are two ways to view it, and we'll get to it in a minute. But here, this one is to click to view online, because we do have many spreads that, that we'll look at together. That is really nice to be able to look at across the two pages. But if you're going to print a copy, it's best to do this one here, download a printable copy or toolkit. And then are all of the toolkit, additional toolkit resources. So everywhere in the toolkit, you'll see where it says, go to our online toolkit. This is what we're talking about. And so each of these sections, toolkit and planning materials for making change, education and information by substance, statewide and local data, community-wide strategies for town plans and policy development, and additional resources for building healthy communities. And this is always being updated. And so if you have something to add or to contribute, we really want this to be something that is useful and sharing information across the community. And we want to hear from you on this online version. So for example, when I put the link right in the chat of the previous document, I clicked here, community-wide strategies for town plans and policy development. And right up here, a primer on planning for prevention, Healthy Lamoille 2015, the precursor to our new toolkit. So there's lots of information, for people to be able to dive deeper into this. But if we go back and I just take you to the document itself, this is the introduction. This is what we want people to be working with and to introduce people to the topic and to use as a toolkit. So let me just take us through a few of the pages, and then we're going to break out into some rooms to discuss one spread in particular. So many of you have seen it before, but just kind of the overview and what's inside. More about this toolkit, kind of introducing the concept here of that. We have these little Post-it notes. I've got some here on my desk, all different colors, but we really like the idea of making it look like, it's inviting us to engage. So that's the point here. Now you see exactly what Michelle had pointed out, the community prevention lens of being able to really simply notice, heighten our awareness to what youth might see in our community. What are the messages they're getting? And to do that, on this community level, the policy systems level of how we create interventions. And you'll notice still there, the post-it theme goes throughout with questions to ponder, to work on, to think about, to jot notes down. This is a page that we're going to get to in small groups. Where do youth see substances in our community? And we spoke to area youth who at the time were part of our youth council, and really built this out based on their experience, and then started to think, well, this is an engagement tool, and we want to engage any reader to say, well, take a look at your community. What do you see? And so that's a piece that we're going to get back to. The next spread really looks at the risk factors that Michelle discussed and some of the data that really looking at what leads to early use, early onset, first use, and then what some of our Vermont local data says. And then there's a piece of go back to our toolkit and then find our specific local data. That's the Lamoille County specific. And it's helping people to really think about what's the data that you want to look at, that you want to learn about, and also what's most concerning to you. Especially in these times, looking at through a health equity lens is very valuable and important when creating policies and other actions supporting prevention. So we look here specifically at a few different populations, specifically with YRBS data, and just the community impacts of substance misuse. And then when we move from risk factors, we move into protective factors. And so when we can increase our protective factors and decrease the risk factors, we lead to healthier youth and healthier communities. And so this explains a bit about what that can mean for us in communities, but also has questions that an individual or a group that's convened can really discuss and think about to be able to move one's own self or one's group forward in thinking about protective strategies in the community, what already exists and what we might want to enhance. Some of you out there might see your own words here because we did a bit of this in a steering team meeting, but really looking at our visioning for what is our vision related to substance misuse prevention and substance misuse in our communities? What is our vision for youth? Does our question from what we asked earlier in the introductions, you can see it here on page 16, but how does this all relate and really focusing on this? And I should mention that just very recently, as of today, the Morristown Planning Commission approved some edits to a wellness chapter in their town plan to be able to create a committee to look at vision for health and wellness in the community and to create an additional committee on substance misuse, prevention, treatment, and recovery. So that's part of the work that we're doing. We'll get back to this page a little bit later, but really getting into it, what is the influence that each of us has and what can we do? Each of us has say, and each of our towns has say. There are things that towns and municipalities can do. That's what we want people to know about. And it takes all of us as local citizens to be able to make a difference. Concludes here with some next steps in getting started and moving back towards our online toolkit. So this is the online version of the toolkit. And I'm going to put the link here into the chat. Oh, I'm not sure I can do that. I'm going to stop sharing. And here we go. I'm going to put into the chat just for your reference through the next piece. And we're going to break out into a few groups to discuss the spread specifically that's looking at where do youth see substances in our community. And then that leads to taking a look at our community and where do we see those messages in our community. And then we'll share back, but I hope that within the small groups, you can actually read through the whole page and can then have some time for the discussion. We have, I guess, about 7 minutes for the discussion. So I hope folks can jump right in.
Okay, so I'm going to send you all to your rooms. There's 3 different breakout rooms, and there are people who have been tagged to help facilitate discussion. So Scott, thanks for joining us, and we're glad you were able to make it tonight.
I haven't been sent to my room in a long time.
Sometimes it's a good thing. So here we go. Welcome back.
Wow. Hi, everyone. I know some people were left mid-sentence, but I don't know, we can go into gallery view again so we can see everyone. I hope that you're able to at least have a spark of a conversation or start to think about it. Our intention, even in this short hour, was to have a couple of different pieces of the toolkit highlighted. So I'd just love to hear maybe from each group, just, you know, a couple of sentences about your conversation.
You want me to start, Allison? Or?
Jump in, please.
All right. Yeah, we had actually a really wonderful conversation despite the short time. Had some good ideas. We thought it was a really amazing list that the youth council and everybody came up with. So covered a lot of ground. A couple of the ones that we would fill into the bubbles. We talked about free marijuana plants at the farmers markets. Free tastings at various stores, including and as well as the farmers markets. We noted that oftentimes when you have like free wine or gin tastings or whatever they may be in stores, they're really in prominent places where you really couldn't miss that. They're not putting them in a obscure corner. They're putting them right where everybody's going to pass them. And then restaurants, of course, advertisements at youth sporting venues. I used to be like a little league umpire and stuff, and like they would put signage up on the outfield fence where for sponsors of Little League, and some of them would be for like beverage marts and stuff like that. So even in youth sporting leagues, there's promotion of those things, like or if you go to a high school football game and you have like a booster club, stuff like that. So those are the big ones that we came up with.
Great. Thank you so much. And we are, always making this, as I said, a living document and adding to it. So thank you for the comments. Okay. Will someone from another group just start sharing?
Sure. We had a brief discussion. Easy job, Brian, taking the notes for that one. And just a couple comments about reiterating that the list seemed fairly comprehensive to people, and they thought it covered a lot. That there was we're kind of making it normalized behavior in all aspects, is what it appeared. And then a couple of us commented that on the other side of it, having signage outside, for example, the college up at Johnson and the community center here in Morrisville, that was explicit in its no substances. It's a no substance location, was a positive aspect.
Mm-hmm. Thank you. Thanks, Damon.
Yep.
I'm glad I got to join that group for a little bit. And the other group, the third group, anyone? Anything to add?
Anyone? Katie, Elisa, did you want to add anything? I'm sorry, we had a lot of technical difficulties trying to pull the document up on folks' screens, so.
Oh, too bad.
I think what's not on here, we think about these external sources where we're talking about people seeing it, but really it's in the home that we need to include. It's older siblings, parents, grandparents, everybody that they know. To some extent, that's a very close factor and a very influential one.
Good point.
Yes, thanks. If the folks who are in that group with Katie and Michelle need extra support to either get a hard copy or, getting that to come up on your screen online, please let me know. I'll stay on after to help figure that out, or you can email me. So thank you for the conversation. We want to really move now into, so what can we do about all of this? And how does this toolkit help us move to a next step of thinking about protective strategies? So we want to show another page and Jessica's going to share this, another page from the toolkit, jumping around a little bit. It's page 18. And I want to ask you to do something. Does everybody see at the top, you see it says you are viewing Jessica Bickford's screen? Folks see that? If people who are on a screen, if you go to view options right next to it and kind of click that little arrow, go down a bit beyond the percentages, and then a few more down, you see annotate. Do folks see annotate? Thumbs up maybe for some if you see. Okay, again, you are viewing Jessica Bickford's screen, view options, click that, and then go down to annotate and click annotate. Does anyone thumbs up for people with me? Oh, people are writing. Very nice. Hi. You're an expert, Ken. So this is one of the pages, and we don't have a lot of time, but if you can just focus on one area of this page, the questions are, which community level protective strategies can you influence? And that's something to take with us. But if you click up on the top, now if you clicked annotate for the folks who are able to do it, if you click stamp, you'll see different images like a little star, a heart, check mark. If you click one of those, then I see Elisa's got this. If you can look through this for a couple of minutes and just choose one thing that you think is a protective strategy that you can influence. Again, I know you're not going to be able to read the whole thing, the whole document, but if you can at least, find one that you can put your stamp on for a first step. And it's okay if you have the same stamp as someone else. And it's okay to have the same idea that someone else has. And you can also have your own idea. That's great. I see that most people have been able to put something, and I just want to take a picture of it. Let's say we'll give 30 more seconds to add another one if you so wish, and we'll move on to the next step of what we can do, the now what. Wow. You can obviously that we're doing too many things in 1 hour, but I love it. Thank you. Talk to your kids' friends. So it looks like many of the options that we put in here are resonating with you all. And so this is something that we'll be building on into the future, and hope that you can take what you stamped into your next phase of this prevention work. Thank you. Jessica, we'll go to the next slide.
Was there another slide? Oh, yes.
Yes.
Okay. Hold on. Oh, sorry. Sorry about that.
So on the page 4, you will see in page 4, we have the language that is now on your screen of the who this is intended for and the where in the Lamoille Valley. And so at this point, we'd love for you to share in the chat box Who from this list of the who, you can see community members and leaders, youth and adults who care for and about them, local decision makers, select board members, village trustees, municipal administrators and managers. Who out of that list and where, meaning and what town or what specific organization or institution, what area, who can you commit to sharing this with my help? Some of you may be comfortable sharing it, on your own, and we can support you. But even if I could, do it, if we could do it together, we need lots of folks to be on board. This is a community effort. We're a coalition, and we really seek, taking this to the next level and seeing how could we really use this document. We're proud of it, but the work is starting now. And this is really when it's starting, in this introductory session. So if you can start to think about, I see Floyd was that you? We have some people doing stars, but we don't know who you are then. But if you're willing to put in the chat box, who, either general or specific, and what town you're willing to work together with Healthy Lamoille Valley and specifically me, to move this forward and share this toolkit, that would be great. So we can just let you think about it for a couple of minutes, and don't be shy. Add in the chat. I'm sure you can add to everyone, but if you feel like sending it directly to me, I'll also take that.
So just for example, if I know Katie and she's the town clerk in my town, she's kind of like, it's kind of social capital for me, and she's connected and she takes notes at the select board meetings in my town. So I could connect with Katie and show Katie the document, and then, pick my town and talk to Allison, and Allison might be able to support me in introducing this book to Katie.
Or if you were to get on an agenda for a town select board or planning commission meeting, Allison could come and, be a guest presenter. So really looking for people to kind of use their connections about things that they care about in the towns that they live in. So, because as a resident of a community, your select board wants to hear from you. So.
Floyd's idea is cool, about a legislative breakfast with the delegation, a virtual legislative breakfast.
Yeah.
Jessica will deliver scones to everybody's house.
Yeah, and thank you. I know LSUU and the shelter and the recovery center. I think whatever ways folks think, either generally or specifically, that we can support each other, and we can really support our communities to be able to use this tool. And I think that's one of the goals of tonight, is to have that input. And so if it doesn't happen right now, that's great, Elisa. If that doesn't happen, right now, and you start to think about it once we leave, then also please be in touch. So thank you, everyone. Jessica has some announcements to make, but I'm just so grateful for everyone being on and participating with such a high level.
Thank you, Allison and Michelle. So we do just have a couple of announcements, and we'll keep these very brief. So today is Giving Tuesday. It's an opportunity to support the causes you care about. If you were to want to give a gift to Healthy Lamoille Valley, if you go to our website, there's a donation link there. No pressure, but just know that that's an option. We're super excited to have Brian on board, and to have him here tonight. And we recognize that this is a really tricky time to kind of meet youth and connect with the youth, that are on screens a lot. But we've also, over the years, told them don't meet up with people on screens. So what we really wanted to do was kind of do a meet and greet opportunity where parents and youth are welcome to come together and meet Brian. So there's 2 dates scheduled, Wednesday, December 9th, and also Wednesday, December 16th, from 5 to 5:30. Brian is also interested in or willing to meet parents and youth on their time frame. So recognizing that, there could be flexibility in this. And then also related to this, was the Youth Council. So that slide is there. We'll send these out afterwards. But also that we invite you to be involved. There's lots of different ways to be involved with this work in an area that you connect with. So we're just going to continue to kind of share this graphic, and we'll send out a follow-up survey. And that survey is really if you want to be involved or want us to contact you to discuss that more. So Coalition is really about people from all different walks of life coming together around a common issue. And we appreciate your time tonight in being here and doing just that. Our next meeting will be on January 5th from 6 to 7. And it's going to be around the topic of addressing youth vaping. And what are some of the options of things that we can do? How is it, is it still really prevalent? Is it, kind of dissipating? We're kind of going to look at the state of vaping, and we're excited to be able to do that. So thank you so much for being here. And we're happy to send you a hard copy of the toolkit. You can private message me in the chat with your address or email me, and we'll get that out to you. Or you can go to your local library and request a copy. So thank you so much. And feel free to kind of stick around and visit if you'd like. We're not going to rush off, but the meeting is officially done. So, and thank you again to Maya and Green Mountain Public TV for being here. So.